Good evening, doctors. As you all know very well, I already make video that I am going to put important onliners about all 19 subjects before your NEET PG exams. So please revise these all important onliners, memorize by your heart, and if someone asks you in a sleep, then also you are able to answer. Then you definitely going to receive at least 50 MCQs from these onliners, important or related MCQs. I think so because these are very high yield MCQs. I'm going to tell you here, very high yield. Okay, let's start. Delusion. Delusion is a thought disorder. Remember, what is delusion? Delusion is a disorder of thought. And what is it, this delusion? Delusion, I'm going to explain you guys. I already make one video about delusion. That delusion is a person believe in something so strongly, even if you give some strong evidence in contrary, he is not accepting, and he held with his ideas so strongly with false belief that he is right. And even in presence of evidence also he told that he is right and you are wrong. This is delusion. Most common hallucination in schizophrenia, that is auditory, but in auditory that is third person hallucination. Remember, delirium tremens, this is seen in alcohol withdrawal. After withdrawal of alcohol, I already make video on delirium tremens. Watch that. The drug of choice in delirium tremens is diazepam or benzodiazepines. Okay. Opioid withdrawal. Opioid withdrawal, the symptoms develop is yawning, like yawning, ubasilina, and rhinorrhea secretion. Absolute contraindication to ECT is electroconvulsive therapy is by raised ICT, intracranial tension rises. It's absolute contraindication. Remember, these are the very high yield topics and points. Commonest cause of dementia, that is Alzheimer's disease, dementia. Magnon syndrome, this we see in cocaine poisoning. Okay. Commonest type of phobia. Phobia, commonest type is agoraphobia. Agoraphobia is what? Phobia of being in a crowded place. This is the most common phobia worldwide. K complex and spindles we see in second stage of NREM. It's non-rapid eye movement. Okay. Drug of choice for OCD. OCD is obsessive compulsive disorder, that is SSRI, selective serotonin reuptake inhibitor, and the drug is fluoxetine. Okay, the name is Fludec, brand name. Typical antipsychotic with least extra pyramidal side effect is thioridazine. Okay, tianeptine is a serotonin reuptake enhancer. Serotonin reuptake enhancer. Therapeutic blood level of lithium is 0.8 to 1.2 milliequivalents per liter. And the lithium also responsible for causing hypothyroidism. Okay. Psychoanalysis given by segment fruits scientists. Okay. Now, concrete thinking stage in cognitive development is 7 to 11 years of age. Most important indication for ECT is severe depression, very severe depression with suicidal risk, or we can say mania with bipolar disorder with severe depression and suicidal risk. Okay, so in these cases suicidal risk, we are going to use electroconvulsive therapy. Why? To after the electroconvulsive therapy, this is occurs in presence of anesthesia, and ECT also use succinylcholine muscle relaxant, and it causes antegrade and retrograde memory loss. Drug of choice for ADHD, What is this attention deficit hyperactivity disorder? This is treatment of choices methylphenidate. Now, a young female unaware of being underweight, she is unaware underweight, restricted food, she stops eating, as body image disturbance of amenorrhea suggestive of anorexia nervosa, this term. Now another one term is bulimia nervosa, when a lady like to eat so much and then self-induced vomiting. This occurs in bulimia nervosa. Okay. Paranoid personality disorder belongs to this mainly belongs to cluster A. What is paranoid personality? Paranoid personality, I already explained personality lecture disorder, so please watch that. Paranoid is a personality disorder in which a person not able to trust anybody. He mistrust and do not believe on anybody. He believe only on self. Patient intentionally simulate disease, stimulate disease to get medical attention, no other intention. A patient is ill to get attention of people's. Why? This is known as Munchausen syndrome. A patient like to be ill. Why he is ill? Because he want to get attraction towards it or attention towards it of people's and medical attention towards it. This is known as Munchausen syndrome. So these are the very high yield 20 important topics points in psychiatry. So please revise this, and these points will help you to give you confidence in exam. Please solve this, and after that I'm going to give some 20 or 30 points regarding all subjects, and after that we are going to solve the test series also. And finally I want to say thanks to you guys. Thanks for watching this lecture. If you have any queries, any question, you can ask me, and if you still not subscribe my channel, please subscribe it. Like this way I am going to put all subject important onliners. So guys, have a good day, goodbye, and thank you for watching this lecture.